volume to change. Now, this difference, that can be one or the other, is in part because you have two main modes of breathing. You have what is known as quiet breathing, and you have what is known as forced breathing. Okay, quiet breathing is an active inhalation, because it has to be, and then a passive exhalation. Forced breathing is active on both sides. Active inhalation, active exhalation. Now when it comes to quiet breathing, you already know the volume that results from this. Quiet breathing is what we associate with tidal volume. Okay, now it turns out that when it comes to quiet breathing, most of us use our intercostals and our diaphragm equally. You can, however, train yourself to switch which muscle is emphasized. If you use a very shallow emphasis on your rib cage moving, that is the costal breathing. If instead you tend to leave your rib cage alone and really do it with the diaphragm, that's diaphragmatic breathing. Okay, the idea with the diaphragmatic breathing is that this is the one that people more typically train themselves for, and it's usually for reasons of either presentation or for reasons of singing. Okay, singers really learn to sing from the gut. What they're really learning to do is do a lot of diaphragmatic breathing. Now, if you're doing quiet breathing, which means active inhalation, passive exhalation, how is it that you get that volume to decrease? A lot of it has to do with elastic rebound. The idea is that you have elastic fibers in your lungs. And remember, there's a bunch of elastic fibers around each of those individual alveoli. Okay, so both around the alveoli and in the rest of the lungs, that once you remove that pressure, pulling the lungs open, once you remove that, because you've stopped the contraction of the diaphragm, you've stopped the contraction of the intercostals, then they will naturally want to go back down to their normal original size. That will cause the volume to naturally want to decrease. Okay, you also have to remember that if you inhale and raise the rib cage,